The opioid crisis and its history. Opioid crisis is a rapidly growing problem since the 1980s. American Pain Society classified pain as the fifth vital sign and that it should be controlled as such. Opioids overprescribed with subsequent addiction, abuse, and overdoses. Fueled by reimbursement-based systems for patient satisfaction scores and physician incentive to prescribe. Overdose deaths tripled between 1999 and 2019, with over 70,000 overdose deaths in 2019. Opioid crisis impacts many areas from schools, workplaces, and family and personal life. Levels of political and bureaucratic power regarding the opioid crisis. A war against opioids was started from all areas of government, federal, state, and local. Multifaceted approach. Legislation and agencies to create laws regulating opioids and pull offenders off the streets. Funding and organizations for preventative education and rehabilitation. Some examples of both. Comprehensive Addiction and Recovery Act, substance use disorder preventions that promotes opioid recovery and treatment for patient and communities, and the Drug Enforcement Agency. The Institute of Medicine is also involved from the public health standpoint, using local health agencies for education and prevention in communities and schools. Administrative law and the opioid crisis. Examining the CARE Act, 6 main areas of focus. Funding for the education for opioid abuse and addiction prevention, particularly in minors. Increase funding and availability for naloxone to law enforcement officers to administer to overdose cases. Resources to identify and treat drug-addicted inmates using evidence-based practice. Creating the additional disposal sites for unused medication. Initiating evidence-based treatment and intervention programs. Implementing stronger monitoring systems for prescription medication to deter from drug diversion. There are also many subsets of increased focus. Example, development and implementation of E-Force drug prescription monitoring system in Florida to prohibit duplicate prescriptions of controlled substances. Administrative law and the opioid crisis continued. Offenses that are international and across state lines are handled by DEA. State and local authorities are responsible for local offenses. Drug courts often handle sentences with sentencing guidelines from the Sentencing Commission. Ethical concerns in the opioid crisis. Implementation of drug crime sentences. Prisons are overflowing as a result of incarcerated drug offenders. Sentencing discrepancies of drug crimes that should be large sentences but are increased disproportionate to the crime. First offenses may be better suited to rehabilitation and probation as opposed to incarceration and removal from family and workplace. Ethnic disproportion in criminal activity due to areas of higher underlying crime as a way of life and fewer resources. Role of negotiating and bargaining in the opioid crisis. Negotiations and bargains are used regarding sentencing. Bargaining is used to gain information from apprehended convicts to learn of other users and/or distributors in exchange for a lighter sentencing. On the other side, negotiations are used for obtaining more federal, state funding for rehabilitative and education programs, i.e. the Support Act was used to draw down more federal funds for rehabilitation and education programs, including expansions to Medicaid and Medicare. Public policies dealing with the opioid crisis. Policies and legislation will continue to be updated to reflect the needs or appropriate changes that will need to be most effective. Starting at the federal level and trickling down, funding and policy planning have been underway. Federal National Prevention Strategy in 2011, focusing on education and reducing disparities. White House Office of National Drug Control Policy spearheaded the Prescription Drug Abuse Prevention Plan, which targeted the areas of prevention, education, monitoring, and proper drug disposal. Fair Sentencing Act in 2010 reduced sentencing disparity. 2,600 drug courts established, with 120,000 drug offenders diverted into drug treatment programs from the justice system during the time period of 2010 to 2013. Affordable Care Act contained provision for recognizing and treating drug abuse. The DEA, via the Prescription Drug Abuse Prevention Plan, where they partnered with federal, state, local, and tribal connections to aid in the education and proper disposal of excessive prescription medications. DEA increases costs of production materials used to make methamphetamine. As the face of the drug abuse continues to evolve and the new challenges arise, new solutions will continue to be brought to the table to address them.